Hey everyone, today we are going to discuss regarding osteoclastoma, giant cell tumor of the bone, and we are going to have all the key points and all the important learnings, so please stay tuned. So let's go to osteoclastoma. What is osteoclastoma? It is a giant cell tumor of the bone. So it is, as the name implies, you are going to find lots of giant cells, and but the giant cells are not the true tumor cells. They are basically the osteoclasts, and the true tumor cells are the mononuclear stromal cells that you are going to get in the background, that will be in abundance. And the giant cell tumors generally occur in and around the knee joints. So that is the tibia and femur, they are commonly affected. Distal femur and proximal tibia, they will be affected, but no other joints, no other bones, and nothing will be spared from giant cell tumor. It can occur anywhere, even in the small bones of hand and feet also. It can occur, and cases have been found. So these osteoclastomas are potentially considered benign. Most of them are benign, with some cases even turning into malignant transformation with high cellularity and nuclear ATP of mononuclear stromal cells being noted in many of the cases. So these things you need to bear in mind. And some genetic mutations like P53 and all have been observed, but many of the cases are idiopathic. And osteoclastomas typically happen around the middle age, so around 35, that is the average age group of osteoclastoma. So lots of mononuclear stromal cells and giant cells, as we discussed, that will be there. And you may also see lots of hemorrhage and grossly, even necrosis may be seen in grossly also. It will be quite red brown in appearance due to quite osteoclastic mediated resorption of the bone, and hemorrhage, necrosis, variegated appearance may be found in osteoclastoma. So these things are there. And radiologically, how do it manifest? It presents as a lytic lesion, expansile, with a sclerotic thin rim of bone around that, and encroachment into the soft tissue is seen. So a classical soap bubble appearance will be found in osteoclastoma. So these are the key radiological features that you need to know. And even grade 1, grade 2 and grade 3 osteoclastomas have been classified based on the radiological finding and expansion into the surrounding tissue. Different types of grade 1, grade 2 and grade 3 are being found. So now coming to the treatment. How do we treat? So curettage is generally a method of treatment of choice, and with some adjuvant therapy may be given. And even in some large tumors with inoperable, where curettage cannot be done, even joint replacement have been also done in many of the cases. Recurrence rate may be up to few of the cases, like 1/3 of the cases to half of the cases, there may be recurrence with the curettage. So that is all about osteoclastoma. So now let's have a very quick recap before we end the video. Osteoclastomas are benign, but with potential malignant transformation can occur. It is a giant cell tumor with lots of osteoclasts, and mononuclear stromal cells are the true tumor cells. And you are going to see lots of hemorrhage, necrosis and variegated appearance. And the treatment involves curettage, and some adjuvant therapy can be given, and it originates generally from epiphysis and metaphysis of long bones, but small bones may also be involved. Thank you.
Thank you for watching the video. Please subscribe to the channel, hit the bell icon and follow in our different groups, and please stay tuned for the next video. See you in the next video. Thank you.